Welcome to the deep dive. Today, we're really getting into something important, ADHD medications.
Yeah, it's a big topic.
We've gathered information from places like the Cleveland Clinic, Medical News Today, Wikipedia, CHADD, Child Mind Institute. Quite a range.
Right. And our aim is really just to unpack it all, how they work, the different kinds, side effects.
Exactly. Trying to make sense of it because, it can feel pretty overwhelming.
It really can. So, yeah, we want to pull out the key pieces, make it accessible, and maybe clear up some common confusion.
Okay, perfect. So let's jump right in. How do these medications actually work in the brain?
Well, the Cleveland Clinic has this really nice analogy.
Oh,
They
yeah.
compare it to eyeglasses, like how glasses help you focus your vision.
Ah, okay. So the meds help focus your thoughts.
Exactly, sort of sharpens that mental focus. But behind that analogy, there's some specific brain chemistry going on.
Right. Neurotransmitters.
You got it. The sources, Cleveland Clinic, Wikipedia, they explain these meds increase levels of key brain chemicals, mostly dopamine and norepinephrine.
Dopamine. That's like the reward chemical. And norepinephrine is for alertness.
Kind of, yeah. Dopamine plays a big role in motivation and reward, and norepinephrine is crucial for alertness, attention, focus.
Mm-hmm.
In ADHD, these systems might be working a bit less efficiently.
So the medication just gives them a boost.
Basically, yes. It makes those chemicals more available, which helps the brain's communication pathways for attention and impulse control work better. It's not just about feeling awake. It's more about enabling that underlying circuitry.
Okay, so boosting those chemicals, what does that actually look like day to day?
Well, it translates into improvements in those core ADHD challenges. The Cleveland Clinic mentions things like, a better attention span,
Makes sense.
less hyperactivity, more control over impulses, and also managing what they call executive dysfunction.
Executive dysfunction,
Yeah,
like the brain CEO having a tough day.
sort of. It's about planning, organizing, time management, memory, emotional regulation, that whole management system. The meds can help smooth that out by improving the neural communication.
That sounds really significant. But something that really stood out from, well, all the sources really is that it's not one size fits all.
Oh, absolutely not. That's a critical point. Cleveland Clinic really stresses this. Meds affect everyone differently.
So what works great for one person?
Might do nothing for someone else, or cause side effects they can't tolerate. Finding the right medication, the right dose, it often takes some time, some trial and error with a doctor.
Which means keeping that doctor fully informed is key, right? About everything else you're taking.
Totally vital. Cleveland Clinic is super clear. Tell your provider everything. Prescriptions, over-the-counter stuff, even how much coffee you drink, vitamins, supplements.
To the potential interactions.
Yeah, exactly.
Yeah.
You want to avoid anything harmful.
Okay, good advice. Let's shift gears then. What about the different types of ADHD meds? It seems like there are main categories.
Yep, generally two main groups, stimulants and non-stimulant.
Okay.
Although Cleveland Clinic also notes that sometimes antidepressants might be used as part of a treatment plan, too.
Interesting. Let's focus on stimulants first, though, since they seem to be the most common ones prescribed.
Right, and it's kind of fascinating. They're called stimulants, but they don't just amp everyone up,
Right. They actually help focus for people with ADHD.
Precisely. As Cleveland Clinic and Medical News Today explain, they specifically target those neurotransmitters we mentioned, dopamine and norepinephrine, the ones involved in attention, focus, thinking, motivation.
They seem pretty effective. Cleveland Clinic mentioned a number.
Yeah, around 80%. About 80% of kids with ADHD experience fewer symptoms once they find the right stimulant and dose.
That's a high success rate.
It really is, which explains why they're often the first thing tried. But, and this is important, because they can be misused.
They're controlled substances.
Exactly, as all the sources mention. But, crucially, when used as prescribed under medical supervision, they are considered safe.
I also saw something about needing an EKG sometimes before starting a heart check.
Yeah, that's a safety check. Cleveland Clinic says it's to screen for any underlying heart rhythm issues, just to minimize potential risks.
Makes sense.
And also worth remembering those legal things, like limits on prescription length, 30-day supplies in some places.
Right, practical stuff to know. Okay, Medical News Today had a huge list of specific stimulant meds.
Oh, yeah, it really shows the variety. We've got the methylphenidate-based ones.
Like Ritalin, Concerta.
Exactly. Concerta uses that special OROS tech for a long, slow release, like 10, 12 hours, aiming for steady coverage.
Compared to Ritalin, which is shorter acting.
Right. Ritalin SR often need multiple doses a day. Then there's generic methylphenidate ER, cheaper, but maybe not exactly the same effect as concerted clinically.
Lots of options even within that group.
Totally. Methylene comes as liquid or chewable. Contempla XR ODT is a dissolving tablet, lasts 8-12 hours. Journey PM is interesting, take it at night, starts working hours later. And Quilivant XR, Quilichew ER, Adhancia XR, Aptensio XR, Relexi, Focalin XR, the list goes on. Different delivery systems, different durations.
And then the other main group of stimulants is amphetamine-based,
Yeah.
like Adderall.
Yep. Adderall XR is long-acting, 10-12 hours. Vyvanse is another big one.
Vyvanse is the one that's a prodrug, right? The body has to convert it.
That's the one. Medical News Today explains this conversion leads to a smoother, longer effect, maybe 13-14 hours.
Interesting mechanism.
Yeah. Then you have dexedrine, regular, and the Spancel extended release. Cellstrim is a patch. My days last even longer, up to 16 hours.
Wow, 16 hours.
And liquid or dissolving tablet versions like Adzenys ER, Dineval XR, plus newer ones like esters combining different ingredients.
So why so many different ones?
It comes back to that individual response we talked about. Brain chemistry, how someone metabolizes the drug.
Yeah.
It all varies. So having lots of options increases the chance of finding a good fit through that trial and error process with a doctor.
Okay. With all these options, we definitely need to talk about side effects.
Absolutely. A really important part of the picture. Cleveland Clinic, Medical News Today, they both list the common ones.
Appetite loss seems like a big one.
Yeah, decreased appetite affects a lot of people, maybe around 80%, which can sometimes lead to weight loss, though usually manageable.
What else? Sleep problems.
Difficulty sleeping is common too, yeah. And something called the rebound effect.
Rebound.
Like when the medication wears off, you might feel tired, irritable, maybe even more hyper for a bit.
Gotcha. Any others?
Some people might feel more anxious or notice an increase in depressive feelings. Tics, if someone's prone to them, might become more obvious.
Cleveland Clinic also mentioned a small potential growth delay in kids.
Yes, but they emphasize it doesn't usually impact their final adult height. And then maybe some stomach upset or minor changes in blood pressure and heart rate. Usually small increases.
That sounds like a lot, but you mentioned they can often be managed.
Definitely, that's key. Cleveland Clinic outlines strategies doctors use. Adjusting the dose, changing the timing.
Switching to a longer-lasting version, maybe?
Exactly. Extended release can help avoid those peaks and valleys, or trying a different stimulant altogether, or even looking at the non-stimulant option.
Right. And I imagine for parents, that appetite thing could be really worrying. Are there tips for that?
Yeah, often doctors suggest things like having a bigger breakfast before the meds kick in, or offering calorie-dense snacks later when appetite improves, things like that.
Good to know there are strategies. Okay, so that brings us to the other main category, non-stimulant medications.
Right. These work differently in the brain, as Cleveland Clinic explains, different pathways than the stimulants.
And they can be used instead of stimulants or sometimes with them.
Exactly. They're an option for people who maybe don't tolerate stimulant side effects well, or if stimulants just haven't worked for them.
Okay. What are some examples? Strattera.
Strattera is one, yeah. It mainly increases norepinephrine. Qelbree is a newer one, works similarly. Intuniv XR is another, often used for kids, lasts a long time.
Anything specific to know about those?
Well, Medical News Today points out Strattera capsules shouldn't be opened. The powder can irritate your eyes.
Oh, good tip.
But Qelbree capsules can be opened and sprinkled on food, which is helpful for some. And Intuniv XR for kids 6-12 shouldn't be crushed or chewed. It can also sometimes cause fatigue or lower blood pressure.
Okay, so now the big question. Medication or no medication? What do the sources say about that choice?
Yeah, Cleveland Clinic and CHADD address this. Medication is often considered the first-line treatment. And like we said, it works well for a lot of kids, that 80% figure.
But the side effect concerns are real.
Totally understandable. And that's where alternatives or complementary approaches come in, like behavior therapy.
Right. Teaching coping skills and positive behaviors.
Exactly. Helping manage the behaviors associated with ADHD. The American Academy of Pediatrics, according to Cleveland Clinic, actually recommends parent training and behavior management first for younger kids under 6.
Before medication.
Often, yes. Then, for kids over 6, the recommendation is frequently medication plus behavioral therapy, a combined approach.
Makes sense, tackling it from different angles. And CHADD had that interesting research finding.
Yeah, quite striking. Looking at large data sets, their research suggested that when individuals with ADHD were on medication, they had a lower risk of motor vehicle accidents and suicidal behavior compared to when they were not medicated.
Wow, that's That's significant of a potential protective effect.
It adds another layer to consider based on population data beyond just symptom management.
Okay. This feels like a good point to tackle some common myths. Child Mind Institute had a list. Seems like there's a lot of misunderstanding still.
Oh, for sure. Myth number one, kids with ADHD just can't focus on anything for long.
Not true.
Not quite. Childmind says they might have the inattentive presentation. The focus might be there, but directing it is the challenge. They can sometimes hyperfocus too.
Right. And the idea that if a kid isn't bouncing off the walls, they can't have ADHD.
Another myth. Again, that inattentive presentation exists. Hyperactivity isn't always the main feature.
What about the idea that it's mostly boys?
Also needs busting. Girls are often underdiagnosed, as Childmind points out. Their symptoms might look different.
And the myth that kids just grow out of it.
Nope. Often persists right into adulthood, and it's really important to know ADHD is primarily genetic, not caused by bad parenting.
That's a crucial one. What about ADHD versus ADD?
ADD is just an older term, Childmind explains. It's all under the ADHD umbrella now, not two different things.
Okay. And the fear about stimulant meds leading to addiction later.
Research doesn't support that. When used as prescribed for ADHD, stimulants don't appear to increase addiction risk. Some studies even suggest they might lower it slightly.
And finally, the idea that meds will change a child's personality, turn them into a zombie.
Generally untrue. If side effects like sedation or moodiness happen, it usually means the dose or medication needs adjusting. It's not the intended effect.
Good to clear those up. So how is ADHD actually diagnosed? Wikipedia had some detail on this.
Right. It's based on a really thorough evaluation, looking at behavior, development, and importantly, ruling out other possible causes for the symptoms.
And getting input from others is key. Parents, teachers.
Definitely. That feedback is a big part of the picture for kids especially.
Wikipedia mentioned the DSM-5 criteria. What are the basics there?
So the DSM-5 sets out specific requirements. Symptoms need to be present for at least 6 months and be more severe than you typically see for someone that age.
Yeah, and it's a certain number of symptoms.
Yeah, for under 17s, it's at least 6 symptoms of inattention or hyperactivity impulsivity. For 17 and older, it's at least 5.
And they have to cause problems.
Big time. They need to show up in at least 2 settings, like home and school or home and work, and clearly interfere with functioning. Plus, several symptoms need to have started before age 12.
It also said the diagnosis is clinical, not based on a blood test or scan.
Exactly. There's no single biological test, but it's based on standardized, well-validated criteria. It meets the standards for a valid mental health diagnosis.
What about those rating scales? Questionnaires.
They can be useful tools for gathering info from different people, parents, teachers, the person themselves. Wikipedia notes they're usually pretty consistent internally, but, different people might rate things slightly differently.
And diagnosing adults?
Usually involves looking for evidence of symptoms back in childhood, though late onset is recognized sometimes, maybe first appearing in adolescence or early adulthood. And a huge part of diagnosis is ruling out other things.
Differential diagnosis.
Right, making sure it isn't actually anxiety, depression, bipolar, sleep issues, or something else that can look similar.
Okay, lastly, let's zoom out a bit. The overall impact of ADHD. Wikipedia painted a picture. It's much more than just attention problems, isn't it?
Oh, absolutely. Wikipedia describes it as stemming from differences in how brain regions involved in executive functions develop and work.
So that affects self-regulation.
Profoundly. Things like time management, impulse control, starting tasks, sticking with them, staying focused. It all gets harder.
And that can have real-world consequences.
Yeah, unfortunately. Difficulties at work or school, relationship challenges, even increased health risks. It can really impact quality of life, potentially even life expectancy in some cases.
And it often doesn't travel alone, right? Comorbidities.
Very common. Having other mental health conditions alongside ADHD is frequent. Sometimes physical health issues too. Genetics play a huge role, high heritability.
What about environment?
Environmental risks seem to be mostly early in life, and rarely it can be caused by brain injury or a major genetic issue.
Interesting that hyperfocus is also related.
Yeah, it's seen as part of that difficulty with inhibiting or shifting focus, and there might be a higher risk for substance use disorders.
And that rejection sensitivity thing.
Rejection-sensitive dysphoria, yeah. Intense emotional pain from perceived rejection or criticism. Very common for people with ADHD. Wikipedia also mentions links to some metabolic disorders and, sadly, higher accident rates, including traffic accidents.
And actual brain differences.
Yeah, studies showed differences in brain size in certain areas, connectivity between regions, and how those key neurotransmitters, dopamine and norepinephrine, function.
Wow. Okay, so wrapping this all up, if you had to boil it down, what are the absolute key takeaways from this deep dive?
Well, I think first, ADHD meds work by influencing brain chemistry, boosting dopamine and norepinephrine mainly. Second, you've got stimulants and non-stimulants, lots of options within those, each with different profiles and potential side effects.
Okay.
Third, medication is a primary treatment, often best with behavioral therapy. Fourth, so many common beliefs are just myths. It's important to get accurate info. And finally, diagnosis is careful, clinical work, looking at behavior over time and ruling out other causes.
That's a great summary. And it really makes you think, considering this complex link between brain behavior and how meds can help, what does this all mean for how we view neurodiversity? For understanding attention and focus as deeply personal experiences.
Right, it's a huge question.
This dive gives us a foundation, but there's clearly so much more nuance to explore in ADHD and finding truly personalized support. Thanks for exploring all this with us today.